Some complications of chlamydia, particularly if left untreated, would be pelvic inflammatory disease or PID. And within PID, you can have fertility issues, ectopic pregnancies, tubal scarring, and chronic pelvic pain. You can also have perihepatitis, which is also called Fitzhugh-Curtis syndrome. And so this is inflammation of the liver capsule, and really is a result of untreated pelvic infections in women. So what are some testing options? So nucleic amplification tests, or NAATs, are really simple to use, and optimally they're the most sensitive test. So if you look at men versus women or both, and you look at the sites at which you're testing, so for urethral, GC and CT in men, there is the option of a urethral swab, but really the first catch urine is optimal. For cervical, in women, the GC, CT testing, you could do a cervical swab, you could have a clinician-collected vaginal swab, but really the optimal option for this type of test is a self-collected vaginal swab. And we'll talk about this a little bit later in another module on self-collection. So the oropharyngeal GC, CT for both males and females. You could do a culture, but that takes more time. But the nucleic acid amplification, or the NAATs, that swab is actually the preferred. And so rectal, if you're concerned about rectal GC or CT testing, for both males and females, the NAAT swab is preferred over culture, and it is more sensitive and specific. So these are just the chlamydia screening recommendations.